episode 8 of In Clinic. I'm your host Danelle, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
On today's episode, we're going to dive into the world of fat-dissolving injections. We're going to look at what they're made from, their applications, some of the risks that are involved in treatment, and whether fat-dissolving injections are right for you.
So what are fat-dissolving injections and how do they work to reduce fat in targeted areas?
So fat-dissolving injections are this non-surgical cosmetic procedure aimed at reducing localized fat deposits. Now, they typically contain this compound known as deoxycholic acid, which works to break down fat cells by disrupting the cell membrane. Now, once it's done this, the byproducts are then metabolized by the body, which essentially makes fat disappear over time and results in a slimmer appearance.
So can you explain the difference between fat-dissolving injections and other fat reduction treatments, for example, liposuction or cool sculpting?
So liposuction is this surgical procedure which physically removes fat from the body through means of suction, whereas cool sculpting uses controlled freezing to essentially destroy fat cells, and then the body will naturally get rid of them over time. And then fat-dissolving injections involve this process that we've just mentioned, where we inject deoxycholic acid into the localized fat deposit. The body will break it down and then remove it over time.
So how are fat-dissolving injections administered, and what areas can they be used to treat?
So fat-dissolving injections can be administered either by injection directly into the area or by use of cannula. Now, the most common areas for treatment are underneath the chin, the stomach, the sides, and the lower back, but it can also be used off-label to treat other areas of localized fat deposits.
So are fat-dissolving injections suitable for everyone, or is there a certain criteria that patients must meet before undergoing these injections?
So fat-dissolving injections are generally very, very safe and well tolerated for healthy individuals who are struggling to lose stubborn pockets of fat through diet and exercise alone. Now, there are a few instances where fat-dissolving injections are contraindicated. So in the case of pregnancy and breastfeeding, or if somebody's clinically obese, fat-dissolving injections just shouldn't be used in these circumstances.
So what are the potential side effects associated with fat-dissolving injections and how common are they?
So some of the common side effects include redness, swelling, bruising, and some tenderness in the area. Now, these tend to be pretty self-limiting and tend to resolve after a few days, but they can be managed with the use of compression garments or oral pain relief, and the patient can tend to return to normal activities after just a few days.
So how soon can patients expect to see results, and how long do they typically last for?
So patients will tend to see results within a few weeks after treatment once the metabolized fat cells have been eliminated from the body. Results are generally long-lasting, but they do require the maintenance of a healthy diet and exercise just to prevent the reaccumulation of fat in the area that's being treated.
Are multiple treatment sessions necessary to get the desired result, and if so, how far apart do these sessions need to be?
Now, multiple treatment sessions are often recommended to get optimal results. It just depends how much fat there is in the localized area that we're treating. Now, these sessions tend to be spaced about 2 to 4 weeks apart, depending on the type of side effects that the patient experiences. Because this gives us a chance to really let the fat that's been metabolized become eliminated, and it gives us a chance to assess results and see where we need to go from there.
Are there any lifestyle changes or post-treatment recommendations that someone should follow to optimize their results?
So patients should avoid exercise for up to 48 hours post-treatment to allow any swelling or tenderness to subside. And then we recommend the use of compression garments in the treated area to allow for lymphatic drainage of the disrupted fat cells.
What are some common misconceptions or myths about fat-dissolving injections?
So one common myth is that fat-dissolving injections can be used to replace healthy diet and exercise. Now, this isn't the case. In fact, fat-dissolving injections should be used in conjunction with a healthy diet and exercise to provide optimal results. Another common myth is that fat-dissolving injections will give you the perfect result after just one session. Now, this is absolutely not true whatsoever. In most circumstances, fat-dissolving injections require up to 3 sessions and sometimes can require up to 10 sessions, depending on the amount of fat in the area that we're treating. If you'd like to book a consultation or to find out more about the different treatments that we offer, hit the link in the description, which will take you directly to our link tree, where you can contact us via WhatsApp, or you can download our treatment guide directly to your device.
Don't forget to like and subscribe if you enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when the next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.